Hello, good afternoon, good morning, good evening and welcome. My name's Nurse Richard, the Wax Wizard, and welcome to episode 114. 4 is in this little compilation for you today. First two, you can see this one here, it's not very blocked at all. The other one was very blocked with this really hard, dry, crusty wax. Now this isn't the best quality video you'll see, and the reason for that is this young man, he was only 6 years old. That's right, he was 6. He was an absolute superstar, very patient throughout this procedure, and is pretty still, well, as still as any 6-year-old can be, to be honest. Obviously this wax, it's a little bit wobbly, a little bit blurry in places as well. But he was so good, bless him. He'd been struggling, his mum had noticed he'd been struggling for quite a while. I'd already tried to have a go at that without any oil. You can see it was just rock hard. Couldn't get a good grip on it. You need a full seal, as you know, so what we've done, squirted a load of olive oil in there and hoping we can get a decent grip with that. Now, this tube here that I've got in there, that's the fine end tube. There's 2 tubes that we use. There's a standard size tube and then there's a smaller tube which attaches on the end of the standard size tube. You'll see the difference between the two. This is the fine end and it's only 1 millimeter. So if you're not sure how big that is, get your ruler out, go and have a look. It is absolutely tiny, which you can appreciate sometimes how difficult this is. It's really, you have to be really precise. And the other one is 2.1 millimeters, so it's just over double the size. And I needed that at the end, and you'll see why. The reason why I used it is because any child is usually, it's quite noisy. Obviously, when you put the full size tube in, it makes kind of a type noise, and then that's quite loud when it's in your ear, so it can be very distracting for them. So I always find it safer to get it out with the fine end tube, if you can do. Now it can take a bit longer sometimes because with the fine end tube comes a bit less grip, a lot less suction power because it's a smaller circumference, so there's a bit less suction power, which makes it even more difficult. So what I'm hoping to do here, as I'm nearly there now, is trying to just lift it up, wiggle it and loosen it basically, and bring it nearer to the entrance of the ear canal. And then I'm going to get the full size tube on, because it just didn't have the power of the fine end tube to pull this through. But it was good for loosening it and wiggling it and bringing it further out. But he deserved his stickers, this young man. He was an absolute legend, really sweet little 6-year-old boy. And yeah, I'll see a lot of children. I don't think there's many providers near me who are either brave enough, insured enough, experienced enough or daft enough to see children. But I love having little people in the clinic, especially seeing the difference that it makes to their lives, you know. It can affect them massively. So as you can see, now is going to come the full size tube. Now look at the difference in size of that one. It almost fills the entire ear canal, doesn't it? And like I said, it's only just over 2 millimeters wide, this thing, which is why there wouldn't have been room to put that and the endoscope in this ear at the same time. So we really had no choice but to use the fine end tube. Same with tools, really. I didn't feel it would have been safe for a couple of reasons. You need a bit more room when you've got the endoscope and some tools like forceps and what have you in there. And you also, you need room to navigate. And when your ear's full of tools, you literally can't see what you're doing. So I didn't think that was safe. And there it is, a little bit blurry. There's oil all over the place, but you can see it's gone, and it's pretty clear. Now the other one, even though it was tiny, it still presented me with a bit of problem. Now we decided to remove this. You can see the eardrum in the distance. It's not affecting his hearing this side, but it's certainly worth getting this one, because one like this is only going to grow and probably turn into one like the one we've just removed. So it's more about preventing a future problem with something like this. But again, this is the fine end tube, and it gets really tricky. When you have these this wax that's all different funny shapes and sharp edges, and it's quite angular, they're the hardest ones to remove because you need a full seal. And when there's just edges and bits popping up all over the place, it's hard to get a full seal with the end of the suction tube. Because when you get that full seal, a lot of regulars will know this. It's like teaching your grandma to suck eggs. You need that full seal and able to get the power. because when there's a full seal, the power increases in the tube, in the machine. It makes it work harder, and therefore it can pull it out. So just managed to lift this up, and you can see there's a bit of an edge at the bottom there. It's a bit more moist, that one, so it might be better. Even though we haven't got a full seal over it, you can get a slightly better grip when it's a little bit wetter like that. And there we go, we've managed to wiggle that free. So we've not needed to use the full size tube in that one. And yeah, the difference it made, it was remarkable. Kids are always honest, aren't they? You know, I've had some in and I've removed some huge pieces there, and I said, do you notice any difference? And they said, no, can't tell any difference. But this little man, he noticed a huge difference. Yes, there is a bit of staining at the bottom of the ear canal. That's probably because of all the drops that they'd been drying. It's left a bit of stain, residual wax around the eardrum there. Another two here. These were dead straightforward. Very soft and mushy. But I wish they all went like this. Now I'm just going to tidy up a few little bits around the outside first before we go in and grab this one. As you can see the difference in consistency already, can't you? It's really soft. Gets a little bit darker, a bit lower, so I'm just trying to, when I come back like that, it's because I'm looking at it and thinking, where should I put the tube next? And so I just put it at the bottom there and lift it up and drag it out. And it came out quite well, this one. Again, big difference that they noticed. Again, as per the last episode I uploaded, thank you so much for all the positive comments on the potential of a merch store. So many people said, yeah, where can I get it? Where can I get it? You can't get it anywhere yet.
Not far off.
But because it was just a tester, really. I was just seeing, is anyone actually interested? And there was a lot of interest, especially in the mugs, because I know a lot of you guys, especially for the long ones, you like getting a brew and having a cup of tea or a cup of coffee along while you're watching some of these. So why not do it from one of my mugs? But the boss, i.e. the missus, she's going to be setting up the e-commerce store in the next fortnight, really. But I want to make sure it's as good as it can be before I let you guys loose on it. So anyway, I hope you enjoyed that. But for now, take care of yourselves, and I will see you later. Bye-bye.